The distribution of healthcare costs on a per-person basis is actually very uneven. Only 20% of the population accounts for 80% of healthcare spending. The sickest 5% of people account for half of healthcare spending. 5% of the population accounts for $1 trillion a year. The sickest 1% accounts for a quarter of all healthcare spending. So when we get sick, it's very expensive. I had cancer 12 years ago. That was a really expensive year of $100,000 of care. So that's an important thing to remember. And another thing I would mention as part of that is please refrain from talking about sick people versus healthy people. We're really just sick and not yet sick. All of us will have a turn in the expensive end of the healthcare spending distribution, if nothing else when we have kids. Having a baby is pretty expensive, but eventually all of us will have at least 1 year that's a very, very expensive year. For health insurance to protect us when we are sick, just like for an airbag to protect us when we get in an accident, it has to meet 4 tests, all right? All 4 tests. It has to be available to us. It has to be affordable. The premium has to be something we can afford to pay relative to our income. The coverage needs to be adequate. It actually needs to reimburse all the care that we need. And it needs to be those things all of the time. It's important to also understand that for health insurers to make money, it is, and in a competitive market, insurers will always compete to avoid the people who are sick when they are sick, because that's how you make money. If you can charge an average premium and only get the healthiest, which is most people, all right, 50%, the majority of the population only accounts for about 3% of all healthcare spending, all right? They're only a couple $100 a year. So if you can sell health insurance at an average premium and just sell it to the sick people, you will make money. And if you just pick up a couple or just to the healthy people rather, if you just pick up a couple of sick people, you will lose all of your profits. So and the competitive insurance industry will always try to make health insurance not work for people when they're sick. Either make it unavailable, unaffordable, inadequate, or change the availability, affordability, and adequacy over time to take it away from you after you get sick. The only way to make a competitive health insurance market take care of people when they're sick is to regulate it. You have to have rules that say no cherry picking, no lemon dropping. You need to take people and you need to keep them and you need to pay their claims and you need to do all of those things all of the time.
As Karen Pollitz talked about, states to pick the state they want, the insurance companies to pick the state they want to be regulated in and to sort of cherry pick the best states. You have a situation where insurers are going to be able to gain better control of their costs, really at the expense of the individual. Robert Gordon on the previous panel has a pretty interesting analogy here to the credit card industry, where he talks about why all credit card bills seem to either go to North Dakota or Delaware, and it's because those were the states that set up the best deals for the credit card companies once regulation there was eliminated in favor of letting states do what they wanted. When states did what they wanted, they worked with specific states, and today most credit cards bills go to just a handful of states. And it's because those are the ones that gave them the best deal. The second benefit, I think, is really just this whole notion of increasing the use of the individual market. Is a factual matter. The individual market is more lucrative for insurers than the group market. You can have a higher profit margin. You can find ways to control the care that you're paying for and delivering because the rules are already weaker to begin with. And in fact, the Center for American Progress Action Fund put out a paper saying that if everyone in the employer-based market today moved into the individual market the way Senator McCain has expressed he wants and would think would be a good thing to have happen, that you would increase administrative costs by $20 billion in healthcare. That's $20 billion with a B, just for paperwork, just for the administrative costs of either underwriting, of the extra marketing, and simply the better margin that insurers enjoy on individual market products rather than the group products that are mostly used today.
As both Karen and Peter have mentioned, McCain would provide everybody with refundable tax credit to subsidize their purchase of health coverage. And I believe he has also said that that could be used to supplement employer-sponsored premiums to buy group coverage. But what we really know is that as employers start to pull out of paying premiums, which is something that they're already starting to do, but by changing the tax preferences, I think we'd see much more movement in that direction. The credits of $2,500 for an individual or $5,000 for a family are something that a lot of people have likened to being a 5-foot rope in a 10-foot hole. That the cost of comprehensive group coverage through the employer market right now, the average, and appreciating Karen's comments about averages, we do see a fair distribution in premium costs as well, but is over $12,000 a year for a family. And an analogy that also occurred to me this weekend as I was thinking about it is that those credits are a little bit like a bridesmaid's dress, which flatters nobody and fits nobody, but it's a one-size-fits-all credit that everybody gets and then has to make the best of it as they go to purchase coverage. So what we would really see is insurers who they don't need to compete on cost because they're able to compete on the other mechanisms that Karen's been discussing. They can compete on cherry picking enrollees and dropping people who are expensive, and they can also manage to design benefit packages that are pretty skimpy, and therefore they may come in at a low cost, but all that's really doing is then pushing costs onto families and individuals as they get sick and actually need health care services.